House metaphor, explaining trauma and EMDR. In order to explain EMDR, let's visualize a house. If we enter a house, we will notice that there are different rooms, each with a different purpose. If you purchase apples, oranges, and milk, you can take them all into the kitchen, even if they're heavy. But if your box has apples, books, and toothpaste, you'll need to stop in this entry and set the box down so that everything can go where it belongs. In this video, the house is a metaphor for one's life, and the term boxes is used to symbolize unprocessed, painful, and traumatic experiences. When we experience life events that go along with one another, like the groceries all belonging in the kitchen, the brain is able to easily process them. Experiences that are mismatched are like boxes collected in the entryway in need of processing. Examples of such mismatches include someone you rely on abandoning you, a safe place becoming dangerous, a person you trust betraying you, and so on. We collect boxes throughout our lives. Some may be small and others big, but they all have an impact. Sometimes due to an increase in adverse experiences, boxes collect until it becomes hard to go in and out of the home. When one's life is cluttered with unprocessed wounds, it's hard to function. People in this state often experience a lot of frustration with themselves and their lives. They may try to ignore the boxes, but this usually only results in more struggle. Over time, some people become so overwhelmed and helpless that they resort to the use of substances or other addictions to avoid feeling the impact of their wounds. Meanwhile, others may seek the help of friends, family, or a mental health professional. Upon seeking therapy, many times a clinician will usually inquire about the contents of a client's boxes. Clients disclose in painful detail about their boxes and the pain within them, anticipating relief. The therapist thanks them for sharing, validates, and normalizes the presence of their boxes, and may provide psychoeducation on ways to live with their boxes. Although the professional is well-intentioned, merely talking about one's trauma is not helpful to most. Clients often leave such sessions feeling frustrated, overwhelmed, and sometimes hopeless after unpacking a lot of painful boxes without any relief or healing. Talk therapies alone, while very commonly practiced, unfortunately do little to change or sort the contents of one's boxes. On the path to healing, many will seek the help of a psychiatrist or prescriber. Using the house metaphor, medication is comparable to expanding the size of the entryway to allow the impact of the boxes to be less overwhelming. While psychotropic treatment can be very helpful, and at times is necessary, over time, the benefits will plateau unless the boxes are addressed. EMDR is an information processing therapy that aims to treat trauma by safely and systematically opening and sorting the contents of the boxes. This therapy should only be administered by a professionally trained clinician. EMDR utilizes 8 phases of treatment. In Phase 1, your therapist informs you about EMDR and how it works, and will introduce you to dual attention stimulus, commonly referred to as bilateral stimulation. They will seek to learn about the boxes or painful experiences interfering with your day-to-day life. They will also learn more about you, your skills, dreams, and hopes for the future. In Phase 2, your therapist will prepare you to unpack the boxes by teaching you a number of calming and grounding skills. You will learn to visualize putting disturbing memories in an imaginary container, like a chest or a vault, for safekeeping between sessions. You will also learn to visualize a calming place and a healing light that streams through your body, and many more skills. These skills are important in order for you to proceed to the next stage of EMDR. Phase 3 involves your therapist joining you in assessing which boxes you want to open, and inquiring with you about the ways in which the boxes impact you at present. In Phase 4, you begin unpacking the boxes, such that you are able to become desensitized to the painful contents. While it's sometimes painful and emotional to go through the boxes, this process is vital to help your brain decide what to keep, what to throw out, and what never belonged there. Phase 5 is about reprocessing and adding new meanings and placements to the painful memories and contents of the boxes. Phase 6 is about scanning the body, as there may be residual discomfort felt. It's important to make sure that your body feels clear and comfortable. In Phase 7, the therapist closes the session by reviewing skills from Phase 2 and giving you information that you'll need to know, including what to expect in the days to come and the next session. Phase 8 involves meeting again to reevaluate what boxes you would like to process next. Thank you for watching.